Good morning. It is February 8th, 2020. I have not done a video for 6 months. The last time I did a video was 10 days prior to my surgery. I have been super busy. I'm currently going to school for nursing. I also work full time. I've gotten married and I've been recovering from surgery. So do forgive all of the time that has passed. I'm going to try to touch on all of the topics that I had wanted to. Sorry, I'm babysitting today. Kids are still sleeping, so not exactly all put together, but that was never a thing for me anyways. It's okay. So I want to start with the surgery. I had a laparoscopic hysterectomy with vaginal assist on July 29th last year. I was given surgery at an outpatient clinic inside the hospital, which meant that they did the surgery for me and they sent me home that same day. Personally, as a general rule, I am not very good with pain management. I have absolutely zero tolerance for pain. What most people can tolerate, I cannot. So when I say that I was in pain, take into account that I have no threshold for pain. So the experience was such that I arrived around 7 o'clock in the morning. They did all of the typical, okay, we're going to go through the past medical history, the typical questions, preparation. I did get a chance to meet with my oncologist before the surgery. He came in, had a few questions for me. How are your symptoms? How's everything going? The anesthesiologist came in. I asked him to give me something for anxiety because historically I panic in the ER. Personally, it's when they put the mask over my face. I am triggered from past experiences. I was in a domestic violence relationship years ago, and for some reason the OR just triggers that for me. So when they put the mask over my face and I feel like somebody's going to suffocate me, it stems from past trauma. So I was very clear with my doctor. I told him about those experiences that I have in the OR. So he was kind enough to give me some medication to calm me down so that when I went into the OR, I was pretty drowsy already. He just gave me something intravenously to help me calm down. Surgery went well. I remember waking up a few times post-op. The first couple times I was crying and yelling a little bit in pain. They were very prompt to give me medication, put me back to sleep. This is things like morphine, and I went through the history. They gave me quite a bit of different pain medications to kind of stabilize my pain. I remember the third time I woke up, I was telling the nurse, I was like, you don't understand. And this time I wasn't crying anymore or screaming. I was just, I was still in pain. So I was like, you don't understand. And of course I'm high off of medication, right? So I'm like, you don't understand. I knew I was going to be in pain, but I didn't think it was going to be like this, So he just gave me some more pain medication, and I kind of lost consciousness again for a little bit. After I woke up, I was calm now. My pain was under control. I was nauseated, but basically I was calm. So they gave me some anti-nausea medication, and they started planning on getting things ready for discharge. My surgeon had gone and spoken to my father, my husband, my sister-in-law, and my husband's niece. They were all there waiting throughout the surgery for me, which was very kind of them. He had gone out probably 2 hours prior and said, oh, she should be ready in about 25 minutes. But because, the hospital has to control pain before they can let you go, it did take a little bit longer for me to get released. About 2 hours after the surgeon went and saw my family, they got me into a wheelchair. I was very loopy at the time. I was kind of in and out. I was in the wheelchair. I know they gave me one of those hospital vomit bags, the little blue ones that extend. I hope you know what I'm talking about. And then they sent me home. I remember telling my dad on the drive home, I didn't realize my car was so bumpy. I have a Subaru Forester. I love my car. But I just, like, every little bump in the road felt so amplified because I still had some of the residual nausea going on. I didn't feel pain, but my body was very aware that something was wrong. So every kind of jostle movement to the car, every turn and all that, I was super hyper aware of it. It was a weird feeling, I remember. So I went home. Everybody had come in, my husband, my father, and I, and my sister-in-law all in one car. I had a pillow that I put between the seatbelt and me just to kind of feel a little bit of support. I didn't use any bands or any of those high top underwear. A lot of women like to use those. Personally, I just didn't want anything on my stomach. It felt bloated. It felt weird. Like I said, I wasn't in any pain at this time. I just didn't want to feel compressed at all. We got home. I went to sleep on the couch. I wasn't talking to people. There was no, haha, how are you? Surgery was this. No, I just went straight to sleep. A few hours later, my husband's niece woke me up. She said, okay, we're leaving. I'm like, of course, just typical me. I'm like, I'm so sorry that I can't be here to entertain you and I'm not talking to you. I'm so tired. I would apologize for that. But then I just went to sleep. I saw her a few weeks later and still apologized. The pain control medication that they gave me was Norco. I was to take, I believe it was 2 pills every 4 hours. About every 3.5 hours, I would start to get to the point like, okay, I want more pain medicine. I'm starting to get uncomfortable. I never had any acute pain. I never had any situation where I was like, this is ridiculous. I need to go back to the hospital. It was never an alarming amount of pain. And I did have my Norco there and available. I want to say the first day I slept all day. The second day I slept all day. I took my medication every 4 hours like clockwork. Even in the middle of the night, I would wake up and need to take the medication. I was able to urinate the first day. Of course, when you have surgery, the medication that they give you and, of course, the pain medication that I was taking, those things kind of cause constipation. So most women don't experience bowel movements for a few days after surgery. I could walk. I was very slow and unsteady on my feet. I had had a lot of different drugs put into my body, so, with reason, I was, I was a little wobbly. My sister-in-law made me some food. I maybe ate a few bites of some sopita, some soup. I had fruit, a lot of fruit those first days. But I really didn't eat a lot. I didn't eat any meat. I didn't want anything. Like, my body was just telling me, no, I don't want to do anything greasy. I don't want to do anything super salty. I just wanted fruit. I needed help getting up. I was sleeping on the couch because it's downstairs. I was not able to go upstairs for the first 2 weeks. I had help to go from a lying position to a sitting position, and then I would sit there for a little bit, and then my husband would help me up, and then I would go to the restroom. I really didn't go anywhere but the restroom. So the first 3 days were pretty much just that. I would sleep all day and get up, go to the bathroom, and come back. By the third day, I really was starting to experience some discomfort from the constipation. I wanted to have a bowel movement. Now, what I'm going to say is not what I'm going to recommend. Don't do what I did. It's not smart. I was just impatient. I'm a typically impatient person, and I don't like being a patient, if that makes any sense. I don't like people taking care of me. I am the caregiver. I took care of my siblings whenever they would let me. I have taken care of patients in, clinic settings. I've taken care of elderly in live-in facilities, demented patients, you name it. I am the caregiver. I don't like being cared for. So I wanted to have a bowel movement. I wanted to make sure that things are going well, I guess. So by the third day, told my husband to go and buy prune juice and magnesium citrate, and I was still taking, okay, so more meds that I was taking. I wasn't just taking the pain medication every 4 hours. I was also taking the Docusate that is prescribed by the doctor, which is a stool softener. I was also taking Azo, which is for urinary health. I don't know exactly. I think it's basically like jam-packed cranberry pills to help you prevent UTIs. It also prevents discomfort when urinating. So because you have not only had an a pelvic surgery, and things have been moving around now because there's this space that they didn't have before, there was also discomfort when urinating because of the catheter that they have to put in when they do surgery. So I was taking Azo and the Ducosate, and I was eating fruits and toast and high fiber things because I really wanted to have a bowel movement. By the third day, I took, I think, 2 cups of prune juice, and I drank half of the bottle of the magnesium citrate, which, like I said, I don't recommend that you do that because that gives you diarrhea. And so I was in pain, of course, because my body was not ready for that. I felt better afterwards, though, so for what it's worth, do not do that. Talk to your doctor if you're concerned. I was just being impatient, and I was a bad patient. Don't do that. But I had a bowel movement, and then I started to feel better. By the third day, I would get up and try to walk to the front door, or if I could, to the end of the driveway and back. And the reason is because you cannot stay in a laying down position even though you want to. When you've had a surgery, you're looking at a risk for blood clots, specifically when you are not getting up and walking around afterwards. It is very important that you walk after surgeries. As much as you can, obviously. Don't push it. You're not expected to go out and run a marathon, right? By the third day, I was trying to walk to the end of the driveway and back, but really I wasn't trying to push myself at all. A lot of sleeping. I did so much sleeping. I watched a little bit of TV. So many people came to visit me. The amount of support and love and just text messages and emails and calls was wonderful. And I found that I had received so much support from unexpected people and sources, and it was wonderful to know that people really care, and it was a good experience for me because I'm always, like I said, the caregiver. I'm always the one that's there for other people. So to see that so many people went to visit me and check on me and brought me fruit and an orchid, and it was very nice of everyone to come by, and I am eternally grateful for that. After about the 4th day, I stopped taking the Norco during the day. I did have enough to get me through the nights, because during the night I would move and toss and turn in a way that I wouldn't when I was in an awake state. So during the night I would have a little bit more pain because I wasn't being as cautious with my movements. My husband slept on the floor. Oh, my honey. He slept on the floor in front of me to make sure that when I had to get up and go to the bathroom or get up and take more Norco in the middle of the night, he was there to help me sit up and then walk. Um, oh, I love that man. um, and that was pretty much the first week. After I want to say 5 days, maybe it was less. It might have been like 3 4 days. I called my grandma, my mother's mother-in-law, and I asked her to help me shower. She actually put me in her car and took me to the home of one of her friends who has a single level home. My showers in my house are all upstairs. So she took me to a friend's house around the corner who has already got a shower chair and a handrail and things of that nature that I really needed. So the first day I showered, I couldn't really, move in the way that you need to move to reach the full extent of your body. So they did most of the washing for me, which is a very humbling experience to have other people wash you. If you are ever in the position where you're washing somebody, if you're a caregiver, if you're a nurse, just know that the amount of vulnerability is incredible. Like if you ever lose sight of it and you treat that experience of bathing somebody else as though it's just a routine and it's just something you got to get over with, I recommend that you ask somebody to do you that favor, that humbling favor of putting yourself in the position where somebody's washing you, just so that you can know how exposed you feel. It's more than just the physical, it's the emotional that comes with that. And it was eye-opening for me. They gave me a shower, brought me home. After about the first week, I started to experience cramps in my legs. I at that point I got alarmed, like, okay, I'm cramping. I am afraid of blood clots. A lot of deep vein thrombosis, which are the blood clots in the legs that people in my cancer group have taken place in the legs specifically. So at that point I was like, okay, I need to get up and I need to start walking more. So since I was not on the Norco during the day anymore, I was feeling a little bit more like myself. My sister-in-law, who bless her heart, stayed with me for the first week, cooked for me, helped me get to the bathroom, did everything that she could to help take care of me. I love my sister-in-law to death. She got up and she would walk with me, around the cul-de-sac. And eventually it came from the cul-de-sac down to, we'd go to the end of the block and back. I would experience leg cramps, really bad leg cramps, when I would walk. And for me, that was just a sign of, okay, you need to do this more. This is not okay. You need to get the circulation moving. It would be so bad that I would have to stop. I couldn't continue walking until the leg cramps had stopped. So definitely, if you go through surgery of any kind and you don't get up for the first few days, make sure that you start getting up and walking more. You want to avoid any type of thrombosis. So that was the first week. By the second week, I had gone another time to take a shower. I think it was 2 days after that, at the friend's house of my grandma. This time I was able to do my own hair. I was able to wash the top of my body. I just hadn't been able to bend over to wash my legs. So I'd gotten help with that. And after the first few days, okay, back up a little bit. When they do surgery, they make little holes inside your abdomen, and then in one of the holes they inject gas to make your abdomen expand. What that does is kind of separates and creates a space where you can move organs around so that doctors can see things and work around the inside. But some of that gas does get trapped inside the abdomen, and it'll move to different parts of the cavities, chest cavity, abdominal cavity. It'll move around until finally your body starts working on making it all dissipate. Eventually it does go away. Um, I had really bad shoulder pain. The gas traveled up to my shoulder, and it was worse than the pain that I was feeling recovering from the surgery. That gas pain is no joke. So I was taking Gas X regularly, but I still had the pain. Thank God my dad had a heating pad. And I swear to God, it felt like my skin was burning. I had that thing on so high, but I would put it on my shoulder, and that was the only thing that I could do to help. The gas pain finally stopped, I want to say, after about the first 2 weeks and dissipated. And by that time, I was up and I was walking a bit. I had given myself my own little sponge bath in the downstairs bathroom that is, it's just a half bath. So I just gave myself a sponge bath from the sink. I didn't need to wash my hair really necessarily. I did have gorgeously clear skin for no reason that I can make sense of. My skin was very clear. My appetite started to come back. I did start to experience some extra oiliness to my hair and to the rest of my body that I wasn't used to. That has resolved. I don't know what to attribute that to. Perhaps a doctor might be able to answer that for me. I have no idea. But for those first few days, my skin was very clear, but also very oily. It was just different for me. I would assume that my hormones went upside down because when you do a surgery like this, your ovaries go into shock. So I want to say my logic kind of makes me think that's why those are related. But like I said, I'm not a doctor. I don't know. By the second week, I was frustrated. Like I said, I'm not a good patient. My sister-in-law, bless her heart, was doing everything that she could, and by the second week I went off on my husband and was like, I want everybody to stop treating me like I'm retarded, like I'm stupid, like I can't take care of myself. And he's like, honey, you can't. um, yeah, so there was that. I started getting to the point where, like, okay, I need to like regain my independence here.